Correction of the bunion deformity involves removal of the enlarged portion of bone on the outside of the first metatarsal head. Soft tissue release allows for proper repositioning of the sesamoid bones. A cut is then made in the metatarsal bone to allow for realignment and correction of the deformity. Appropriate fixation is achieved, and the overhanging ledge of bone is removed.
Treatment of the arthritic joint begins with the removal of a portion of the arthritic bone. The proximal phalanx is then prepared for the implant insertion. The implant is inserted, and this allows for restoration of joint space and range of motion.
A rigid mallet-toe deformity often leads to a painful corn on the top of the toe. The surgical treatment involves excision of the corn and removal of a small portion of the underlying bone. This allows the toe to be straightened with the closure of the skin. The McBride bunionectomy is used to correct mild to moderate bunion deformities. The sesamoid bone may be removed or repositioned. The enlarged portion of bone on the outside of the metatarsal head is removed. Soft tissue repositioning allows for straightening of the toe. A painful corn located in between the toes is most often caused by an enlargement of bone. This may be treated in the following manner. A small incision is made, and the offending portion of bone is rasped smooth. The area is flushed to remove any bony debris, and the incision closed with a simple suture.
Correction of a high arch or cavus foot involves removal of a wedge of bone from the midfoot region. The deformity is reduced and fixation accomplished using the surgeon's choice of fixation devices. A neuroma is an enlargement and inflammation of a portion of nerve located in between the metatarsal heads. As the nerve is compressed, in addition to creating pain in the ball of the foot, it will often send shooting pains into the toes. One treatment option for a neuroma is to remove the involved section of nerve tissue.
A painful corn located in between the toes is most often caused by an enlargement of bone. Surgical treatment involves the removal of this portion of bone. The plantar fascia is a thick, broad ligamentous structure found on the bottom of the foot. During normal walking, this ligament is stretched. With repeated stretching, this can cause inflammation and pain on the bottom of the heel bone. An orthotic device will help support the arch and prevent the plantar fascia from being stretched. A standard orthotic has both a heel support and an arch support area. A digital fusion or arthrodesis procedure is often used to correct and straighten contracted toes. First, the extensor tendon is lengthened. Next, a peg and hole are fashioned in the adjacent sides of the toe bones. The bones are fit together and the toe is straightened. The tendon is then repaired. Fixation may be accomplished using the surgeon's choice of fixation devices. The correction of an ingrown toenail begins with the removal of the ingrown portion of nail. The chemical phenol is then applied, which destroys the nail root and prevents regrowth of the nail. The Raynaud procedure is used to treat painful restricted motion at the first metatarsal phalangeal joint. This condition is also called hallux limitus. The base of the proximal phalanx is shortened and refashioned to allow relative increase in the joint space. This will allow for greater joint range of motion.
A retrocalcaneal spur is a bone spur or calcification arising from the back of the heel bone and often within the Achilles tendon. To remove the spur, the Achilles tendon is first reflected from its attachment on the back of the heel bone. This allows for proper visualization of the spur. Next, the spur is removed and the bone is smoothed. The Achilles tendon is then reattached to the heel bone. The tendon is anchored to the bone using the surgeon's choice of fixation devices. Correction of the Taylor's bunion deformity begins with the removal of the enlarged portion of bone on the outside of the metatarsal head. A V-shaped cut is made in the metatarsal head to allow for proper repositioning of the bone. The deformity is corrected and the overhanging ledge of bone removed. Appropriate fixation may be utilized at the surgeon's discretion.
A painful bump on the top of the foot is commonly caused by an enlargement of bone at the first metatarsal cuneiform joint. Surgical correction involves removing the enlarged portion of bone. Correction of the bunion deformity involves removal of the enlarged portion of bone on the outside of the first metatarsal head. Soft tissue release allows for proper repositioning of the sesamoid bones. A cut is made in the first metatarsal head to allow for proper realignment of the metatarsal bone. Fixation is accomplished using the surgeon's choice of fixation devices. A bone spur found at the end of the great toe underneath the nail is called a subungual exostosis. To remove this spur, a small incision is made at the end of the toe. The bone is then rasped smooth, and the area flushed to remove any bony debris. The skin is closed with a simple suture.